Today we are reacting to a video, my Morpheus8 nightmare. Now Morpheus8 is a radiofrequency skin needling device that's used for skin tightening. So let's have a look.
This is my Morpheus nightmare and why I don't recommend it to anybody. So just a little background, I'm in the aesthetics industry and I constantly was having clients coming in and asking me about Morpheus. So I don't know why. I was like, whatever, I'll just try it.
I've got to say, I mean, she says she's in the aesthetics industry. It'd be interesting to know what she does there. But her skin looks great, looks fantastic. Whatever she's doing the right thing.
Long story short, that was probably one of the worst decisions of my life, and I will explain to you why and show you photos. Photo number 1. This was 2 weeks after getting Morpheus done. I kept contacting the med clinic and they kept saying, it's normal, it'll go away, give it another week.
You see here there's a lot of inflammation happening in the skin here. Now, Morpheus8, there are 25 little needles that go through the skin. So think of it like skin needling on steroids. And once they go through the skin, they fire a radiofrequency current that goes between the needles, and that causes an intensive collagen stimulation. But because there is a little bit of trauma and the radiofrequency current going through, people that are sensitive to these treatments can break out a little bit. You can see there's some little breakouts happening in the skin and also some redness there and a little bit of bumpiness there. So not super abnormal, but I can see why she was concerned. I mean, this is the 2-week mark now. We'd expect it to go away a lot quicker than this, but there are a percentage of patients, maybe 5 to 10% of patients that may look like this after a week.
Okay, so this was about a month and a half after getting Morpheus.
I mean, this poor girl, you come into these cosmetic clinics to get an increased confidence. So you're doing a treatment that's going to make your skin look nicer. She's 6 weeks down the track now. She's still got a lot of redness happening there, and you can see that she's got some capillaries forming. Capillaries are just enlarged little blood vessels within the skin, and when they become damaged, as in a treatment like this, if you've overreacted with inflammation, you can start to see those little capillaries. Very easily fixed with another form of laser, but very distressing.
You can see I still have all of the redness, still have the grid marks in the scarring around my mouth, and at this point I was completely freaking out. So I reached out to the med spa again, and they said I was just very sensitive and that it would just take longer to heal.
I agree with the med spa. Look, she is sensitive. It takes longer to heal, but there are a lot of things we can do. I think it can't be underplayed, some of the anxieties that this can provoke if you've got a skin that doesn't look great. Like I said, these treatments we do for confidence, and this is probably robbing this poor girl of confidence. She's got a slightly darker skin type, and that may have predisposed her to 2 different things that could have been happening here. One of them is called post-inflammatory erythema. So it's a redness that follows trauma. So like if you've ever had an acne spot before and it stays red for a few weeks afterwards, that's what post-inflammatory erythema is, or PIE for short. The next one, you can see she's starting to develop a little bit of this called post-inflammatory hyperpigmentation, which is a pigment that follows trauma. So the Morpheus8 is a controlled trauma, and if she hasn't prepped her skin properly beforehand with a pigment inhibiting cream, this is the kind of thing that can happen. So I would wonder whether she has prepped her skin beforehand properly.
So this was my skin about 4.5 months after getting Morpheus. Again, I only got 1 treatment done because that was enough for me.
4.5 months is a long time down the track to still have some issues after this. I mean, normally if you're going to have any issues, it's a week, maximum 2 weeks. So this is quite unusual.
So these are photos that a doctor took of me about 5 or 6 months after having Morpheus. I was fed up. I was like, I have to do something about this. And you can see in the photo, like the stretched pores, you can see all the pigmentation, all the broken capillaries, all the scarring.
What we would do if we saw something like this is that we would offer complimentary lasers afterwards. We would have prepped the skin properly beforehand. That should have prevented some of this inflammation happening. And we would then, if it was to happen, which is incredibly rare, we would do a laser to smooth this pigmentation to remove the capillaries. She'd probably be looking at 1 to 3 sessions. They'd all be complimentary, and there'd be minimal downtime with those. This is actually quite easy to fix. This kind of case illustrates why you need to know who you're seeing to have treatment done. A treatment like Morpheus8 is very popular worldwide. It was popularized by people like Kim Kardashian. She's had the treatment done. She's made it famous. Lots of people are using it, perhaps without the right experience. They're not prepping the skin beforehand. They're not doing patch testing. They're putting the settings on too high initially. This is a very effective treatment for skin tightening, collagen stimulating, for tightening the jowls and lifting. It's like a very mild non-surgical facelift. Done in the right hands with the right settings, with a prep skin on someone that's not super sensitive, and we've established that this is a very safe and effective treatment.